to undress and remove any piercings. Once I was undressed, a nurse came in and reviewed the forms I filled out previously and confirmed my allergies and whether my medication list needed to be updated. This is important for several reasons. If you are on a specific medication, you will most likely have to stop taking it before the procedure to avoid complications during surgery. In addition to this, the staff should not administer medicine if you are allergic to it. If they address the reaction, that can delay your surgery and possibly the next person's. The hospital is less concerned about what happens to you. The staff just met you several minutes ago. The senior executives and managers are more concerned with not being liable. And if something happens to you, who will pay the bill? That's why they are adamant about this policy. It's a business. Another example of how this ideology of not being liable is carried out is when the OR nurse asked me to confirm the name of the procedure